Good afternoon, and thank you for joining us as we introduce a new framework that will guide provider engagement with the Department of Children and Families moving forward. My name is Christine Norbut Beyer, and I'm privileged to serve as the Commissioner of DCF New Jersey. I'd like to begin by thanking all of you for the work that you do alongside DCF to help children and families in New Jersey be safe, healthy, and connected. When we speak about the child and family serving system in New Jersey, it's so much more than one agency or one department. It's all of us working together to provide quality services and supports with proven positive outcomes. It's the quintessential idea of it takes a village to raise a child. But we also recognize that with an expansive and inclusive child well-being system, there's a wide range of experiences across the system, whether it's families interacting with our staff or engaging with one of our contracted providers in the community. As we look ahead and plan for the future of our system, we recognize that consistent quality and programmatic accountability have to play a key role in our growth. We recognize this when we established the DCF strategic plan, and it's one of the reasons why we included building and maintaining service excellence alongside our transformational goals as a system. We recognized this when we launched the Office of Monitoring to develop benchmarks and metrics for our contracted programs. And today, we're recognizing this again with the introduction of the Office of Monitoring's Quality Standards Framework. On today's webinar, you'll hear from leaders across the department on how they envision the quality standards for DCF providers to be operationalized and applied in each of their areas. This is truly an all-hands-on-deck effort by the department to elevate the services available to our families across the entire service continuum. You'll hear from the team members who developed the quality standards using stakeholder engagement and voice, focus groups, and best practices in people-serving systems. And you'll hear how our new quality standards align with our department's vision, mission, values, and other efforts to gain insight and data from the field. While you'll hear a lot about this new initiative from us, we also want to hear from you. As of this week, the quality standards have been published to the DCF website, and we're currently seeking public comment through September 21st, 2020. You can access the quality standards documentation by visiting the Office of Monitoring website, nj.gov/dcf/monitoring.html. Please take some time after today's webinar to review the documentation and share your thoughts via email to dcf.monitoring@dcf.nj.gov. So once again, the email to share your comments is dcf.monitoring@dcf.nj.gov. Again, thank you so much for your partnership and dedication on behalf of New Jersey's children and families. Working together, we've already accomplished so much for the families we serve, and looking forward, we will accomplish so much more. With that, I would like to invite DCF's first Deputy Commissioner for Operations, Katie Stohr, to share a few remarks. Katie?
Thanks, Commissioner. I'm going to speak to you a little bit about the purpose of the quality standards before we go too much further. When we built the department's strategic plan in 2018 and 19, we talked a good deal about service excellence. Some of you may remember being in sessions in the regional forums or the Children in Court Improvement Committee or other sessions where we really asked a lot of questions about what quality service, what service excellence means to all of us. And through those discussions with you and with constituents, we know a few things. The constituents that we encounter through our work are often experiencing the worst trouble of their entire life. Every one of us are in this work because we want to meet that struggle with help and support that is of the highest quality. Our constituents deserve the very best support or treatment or service during these times. And our job is to see to it that we have set up networks and programs that deliver that service with excellence. So from those discussions, we started to look at, well, what do we mean by excellence? we wanted to come up with an articulation of what it is that every constituent receiving a service from this department, whether that's directly through our own staff or through a program operating under contract in our network of privatized services, can expect. A set of statements that apply across the board to all services, no matter what kind of service the constituent is receiving. Statements that clearly establish for all of us, constituents, providers, and the department, what quality looks like. Given the diversity of services in this department, constructing those standards of quality that apply to our entire portfolio is a lot harder than it sounds. Others will talk today about the processes that we used to arrive at the quality standards and review the standards. As they do so, and as you prepare for any comments you may want to submit, it just might help to bear this background in mind as to why we launched this effort. And with that, I will turn it over to Chastity Garcia, who's the director of our Office of Monitoring.
Thanks, Katie. So we arrived at the quality standards for DCF providers through a number of different processes. One of the ways DCF will achieve the goal of maintaining service excellence for families is through the development of quality standards for purchase services that reflect the best of child welfare models through quality assurance approaches and consultation with statewide stakeholders. We modeled the quality standards after the United Nations Availability, Accessibility, Acceptability, and Quality Framework, also known as the AAAQ or Triple AQ framework, which lays out a set of essential standards for health services. A more detailed discussion of this framework will follow shortly. The quality standards will exist in addition to any contractual or service standards that are already in place for a given program, as you see here. In fact, many of the DCF contracts already include language that addresses the substance of various quality standards. Over time, we will be working to ensure that all of DCF's contracts have embedded the quality standards into the contract expectations. So let me take you through the timeline of the quality standards development. In the summer and fall of 2019, DCF staff conducted literature reviews of existing models to develop the standards. We studied quality assurance and service standards approaches, both nationally and internationally, in child welfare, social work, and healthcare. Concurrently, DCF consulted with its own statewide stakeholders to ensure that various perspectives were considered when developing the standards and conducted internal and external focus groups. External focus groups included the Commissioner's Regional Forum, the New Jersey Children in Court Improvement Committee, the New Jersey Task Force for Child Abuse and Neglect Protection Committee, parents, and youth. Communication, person-centeredness, strength-based approaches, evidence-based practices, trauma-focused practices, family violence, family-centered services, individualized service plans, staff competency, resource knowledge, addressing barriers to services, and cultural sensitivity were some themes that emerged from the focus groups. As a result of the pandemic, progress on quality standards was paused and was reinitiated in November 2021. And in early 2022, we engaged Shape and Hall to conduct a literature review of this drafted quality standards to make sure they're aligned with national and international standards. Lastly, from February to June of 2022, the standards have undergone vetting by executive leadership and were approved by executive leaders in the Safety and Performance Management Committee and by the Commissioner Beyer in July of this year. And as Commissioner Beyer mentioned, last Monday, we published the standards for public comment. So as you know, DCF's strategic plan names its values: collaboration, equity, evidence, family, and integrity. The quality standards are one way in which we are able to share with the constituents we serve, with providers and other key stakeholders, how these values are expected to be upheld within our network of purchase services. The quality standards do not replace any other existing set of principles that are endorsed within any DCF division or portfolio of service. I would now like to provide Molly, Paloma, and Sandy with the opportunity to share their perspectives. So I will start with kids. So we can start with Molly.
Thank you so much, Chastity, and good afternoon, everybody. So I've really been a privilege and a wonderful opportunity to work with Chastity and our other colleagues who are here today as they were building out and developing the standards, and to have an opportunity to review them. And as you see on this slide, and as Chastity also just mentioned, you will find, I believe, that the quality standards are beautifully aligned with the children's system of care and the system of care values and principles that have been the foundation of CSOC for over 20 years. Additionally, by integrating these new standards into the monitoring process, we will establish an equitable and consistent approach to how we review, evaluate, and identify both strengths and opportunities for improvement across all of our service lines. This will happen in a way that will be very particular and measurable in very specific ways for different service lines and different types of services. But again, the new standards will give us a framework and a language across not just our entire system of care, but across the department, where we can look for our strong performance, as well as identify areas for improvement as we move forward through the next phases of this process. Thank you, Chastity.
Thanks, Molly. Sandy?
Good afternoon. Thank you, Chastity. Good afternoon, everyone. We have a wide range of programs in the Division of Family and Community Partnerships, from early childhood programs, including home visiting and the Connecting NJ Hubs, to family support programs that include Kinship Navigator, school-linked services, family success centers, to family preservation and reunification services, as well as housing programs for families engaged with DCP&P and youth in foster care transitioning to independence. The quality standards for DCF providers are nicely aligned with the standards for prevention programs and are really quite important to our division, in that they provide all of us, both agencies and the department, with information that tells us how we're doing, information that's consistent with the mission and values of the department as well as this division. For example, ensuring that services are accessible, including cultural and linguistic accessibility, how collaborations are helping to ensure good outcomes for families that our programs are serving, how barriers to access are identified and addressed, how program delivery is conducted in a manner that addresses stigma, and to ensuring that communities know about our programs and services. So we are certainly looking forward to moving forward with the Office of Monitoring with all of you in this effort.
Thanks, Sandy. Paloma?
Thank you, Chastity. Good afternoon, everybody. So as many of you know, there are a number of state and federal rules, regulations, and laws that dictate the way we work across the field of domestic violence. We must maintain confidentiality and offer inclusive and accessible services that meet the individual needs for each and every survivor. The Division of Women, the Office of Monitoring, and our provider community are working in partnership to ensure that survivors' confidentiality is preserved while establishing the high quality standards that Chastity has talked about and will be talking about in detail as we move along. These standards will provide us with a holistic framework that acknowledges those laws and regulations and will guarantee survivors and their needs will continue to be at the center of all of our services. Thank you, Chastity.
Thank you. So Molly, Paloma, and Sandy, thank you very much. So I've mentioned the AAQ framework several times and promised earlier that we would discuss it in more detail. I'll turn it over to Pam Wilson, the Director of the Office of Applied Research and Evaluation, to do just that.
Thanks, Chastity.
So for those who aren't familiar, the AAAQ framework was developed in the year 2000 by the United Nations Committee on Economic, Social, and Cultural Rights as part of a general comment they issued on the right to health. The framework lays out a set of essential elements that can be taken up by governments to inform the setting of standards and targets for service delivery, particularly in the health and human services spaces. It's been used previously in the fields of reproductive health, water rights, gender-based violence, maternal mortality, and others. So the central tenets of the AAAQ include availability, which is the presence of a sufficient quantity of services to meet the need. Accessibility, which goes beyond just the presence of services to ensuring that people can interact with or use the services provided. This is comprised of several components, including physical, financial, bureaucratic, social, and information accessibility. Acceptability, which means that services respect the culture of individuals, minorities, peoples, and communities, and are sensitive to gender and life cycle requirements. And last, quality, which ensures that providers have the necessary skills, equipment, and training to provide the services with high quality.
Thanks, Pam. So as Pam mentioned, we have identified 4 domains modeled after the UN's AAAQ framework. Once again, these are availability, accessibility, acceptability, and quality. There are 16 standards associated with the 4 quality standard domains. I will now proceed with providing a high-level overview of each standard. As I mentioned earlier, the standards were published on August 22nd for public comment. So no need to take extensive notes. Our hope is that you will read and comment on the standards. Okay. So let's start with the first domain, availability, which states providers are committed to making sure the programs operate according to the contract's capacities and lengths and to avoid duplication of services. Providers strategically coordinate with other partners or service lines available to program participants. Within the availability domain, there are 2 standards. Adherence to appropriate intake and utilization criteria, and the second is building relationships across service networks. The first standard refers to providers following a process of information gathering about participants' needs and verifying that they meet eligibility criteria. The second standard essentially states that as providers deliver DCF purchase services, they will work diligently to create collaborative relationships and partnerships across agencies and programs. And supplemental service delivery will be coordinated by providers and prioritized in accordance with participants and their families' holistic needs. The second domain is accessibility, which states that providers must ensure participants' engagement is maximized and remove barriers to service access by taking proactive steps. Within the accessibility domain, there are 6 standards. The first standard asserts that providers will be engaged in ongoing efforts to understand barriers to access for services provided, and to meet New Jerseyans' needs, providers will communicate information to DCF regarding barriers to access. In addition, they will provide services with strategies that facilitate equitable access, minimize barriers to service, and assess any access obstacles, such as digital accessibility and transportation, etc. Linguistic accessibility states that all providers delivering DCF purchase services will make concerted efforts to understand the linguistic diversity of the program participants they serve and make reasonable efforts to anticipate and meet the needs of non-English speakers when delivering services, including hiring multilingual staff. Bureaucratic administrative accessibility states providers will help program participants complete any required forms, obtain legal documents, etc., before receiving services. Additionally, program participants with literacy and/or numeracy difficulties are supported directly by providers through assessments and support. Standard 2.5, social accessibility, indicates that providers remain sensitive to the potential of stigma for program participants enrolled in certain services and should take proactive steps to provide an emotionally and physically safe environment and experience for them and refraining from discriminating against program participants. Standard 2.6 generally states that providers should strive to understand how to access information about services in a timely and convenient manner and reach members of the community with limited literacy by distributing information about services and community partnerships in various languages, formats, and modalities. The third domain of acceptability specifies that supports provided to the program participants are family-centered, holistic, tailored, culturally responsive, and collaborative. And there are 5 standards associated with this domain. According to the first standard with this domain, service providers should ensure they are delivering services in such a way that policies, procedures, and practices are driven by the perspectives, beliefs, needs, and goals of constituents. The next standard essentially states providers will provide culturally responsive services that take into consideration the needs of individual participants, their families, their communities, and the current events that may adversely impact those communities. This standard is quite detailed, so you may want to take a closer look at once it is published. Next slide. This standard speaks to adhering to relevant ethical and professional standards, followed by respecting client confidentiality and providing confidential spaces for service delivery. As part of the final standard for this domain, providers are encouraged to assess the gender, age, racial, ethnic, and sexual identities of their target populations in order to understand disproportionality in service delivery and ensure that their programs are welcoming and effective no matter what their gender, age, race, ethnic, or sexual identity may be. Lastly, we have the fourth domain, quality, which specifies that services are provided based on required models. Staff are equipped with skills to provide great service, and program participants are treated fairly. The 3 associated standards basically state that contractual requirements and service models are adhered to closely. The staff implementing services has the necessary knowledge, skills, and competence, and that every program participant is treated with dignity, respect, and care during every interaction with the program. So what's next? One thing I want to highlight that has already happened is that the Office of Contract Administration has already helped to crosswalk the quality standards compared to the contracted expectations for the services that we will begin monitoring first. That includes family preservation services, DV direct services, CMOs, IRTs, which is intensive residential treatment services, and psychiatric community homes. As additional monitoring waves roll out, we will continue to crosswalk contracts for consistency. Again, the quality standards for DCF providers was published for public comment on August 22nd. The public comment period will end on September 21st. Please send your comments to dcf.monitoring@dcf.nj.gov, and we will launch the new monitoring approaches in 2023, including monitoring of quality services. So now I would like to invite you to ask any questions you may have.
So I'll jump in, Chastity, if that's okay. I can see that there's a couple of questions in the Q&A, and I'll go ahead and read those. If others have questions, you can pose them in the Q&A as well. The first is, I applaud the creation and implementation of quality standards which are family and child focused and aim to be more inclusive and culturally intelligent. The standards and related training requirements are costly. Are there plans to provide free training? If not, has there been discussion of increasing service reimbursement rates, which for many contracted services have not been adjusted for decades, are well below Medicaid rates, and ultimately influence the quality of the implementation of these important standards. And this is from an anonymous attendee. So I think a few things we could offer in response to that. One is, as you heard from Paloma, Sandy, and Molly, the quality standards that DCF has drafted and put forward for public comment don't depart substantially from standards that are in place already within programs that are contracted by the Division on Women, the Children's System of Care, and the Division of Family and Community Partnerships. So it would be helpful if you can read them and think about whether they really do require additional training. From our review so far of the goodness of fit of these standards with our contracts, they don't seem to be new or different in many aspects from what may be there. It's just a way to, in many cases, organize the statement of quality. In terms of any discussion of rates, I don't know that we can answer that here without knowing the service that's being discussed. So I think what I would say for whoever authored this question, if you can reach out to either Sandy or Molly or Anna Martinez for the Division on Women with a particular question about a service and its rate, that's probably the best next step to take. I'll ask my DCF colleagues and the Commissioner if you have anything else that you would want to add to that question.
No, thanks, Katie.
Okay. The next question is, how do you anticipate measuring these standards among programs? So there, I think we can share, hopefully you all attended last summer's webinar that announced the creation of the Office of Monitoring and marked the release of a different concept paper about monitoring. If you need to refresh your memory or if you weren't able to attend, I think the recording of that webinar is available on our website. The concept paper is definitely available on our DCF website if you look around the website for the Office of Monitoring. And that paper and that webinar describe the way in which we will be systematically moving ahead to monitor programs in a new way going forward, leveraging the quality standards, among other things. And so Chastity made reference to the first set of programs that are going to be monitored using this new method, and she shared those in the previous slide. And there will be additional programs to follow on from there iteratively. That's at a high level. Chastity, do you want to add anything to that with respect to your office or what's been done so far?
I think that pretty much captures everything, with the exception that we are currently working on making decisions around how we're going to weight the quality standards.
Yeah. I think one important thing to just underscore, and Chastity shared it, but just to be really clear, is that we have worked with the Office of Contract Administration to look at the contract language for at least this first set of programs and understand, are these quality standards substantively already included in the contracts, or are these like seemingly new requirements? And in every case so far, the substance of what's being said is already included as a contract expectation. So that's really good news. It's not a big departure from what's already in the contract. That really relates, I think, to the next question. As a contracted provider, will these quality standards be a requirement to show within the contracts, including policies and procedures that address these standards? So again, when we're looking at the substance of what's in the contract, the spirit or the substance of what's included in the quality standard is by and large already addressed in the contract. If there's a need to amend that or state it more clearly in the future, I think that Molly and Sandy and Anna would start those discussions with providers, if the need arises. So I'll stop there and see Molly, Sandy, Paloma, or Ulana. Is there anything that you would want to add to that?
I would just want to reinforce that very specifically, as we've been looking at some of the service lines that are going to be in the first wave, we've been able to, there's been review of the standards, and we've already been able to confirm that, it's all in there. And so I think that we will find that that is more the case than not. I think we may also find that for some of our different types of services. We may not have thought about some of these standards in this particular way for that service line. So it may help us to, improve our way of thinking about what our expectations have been. So I do think that it's a dynamic and iterative process.
Okay. How much of a change will there be in annual contractual documentation? I don't foresee any substantive changes there, but I might be missing a nuanced point. So I think I'll again ask Paloma, Ulana, Sandy, or Molly, do you see that this might cause any change in the documentation with contracts?
Not for us, not for DOW. I don't anticipate. We're already updating a lot of our documentation, so I'm really not anticipating significant changes, maybe some minor nuances, but not really.
And the same for family and community partnerships.
I'm same thing here. I'm not anticipating, significant changes. If anything, this may help us to streamline. Wouldn't it be nice if this helps us to streamline and simplify what some of those requirements are and how we articulate them?
Thanks. Next question, just to clarify, are these standards for all DCF funded programs, and will our PO meet with these regarding the standards? These are for all DCF funded programs, and will our PO meet with these regarding the standards? I'm not sure what that's alluding to. If the person who asked that question could clarify about that, that would be helpful. If that's a reference maybe to program leads in each of the divisions, they have received these draft quality standards too, and they can submit comment as well. Once they're finalized, we'll make sure everybody's aware of them. And like we've been discussing, they're largely already incorporated into contracts. So I'm not sure that there's more to do there, but if we're misunderstanding, I won't lay it on everyone else. If I'm misunderstanding your question, please feel free to clarify. When will information be given out about how these standards will be operationalized or measured for service lines? Will there be a review tool for all service lines or different review tools for different service lines? I'm going to see Pam or Chastity. Do you want to speak to that?
Yes. So in regards to these standards and how they are operationalized, so yes, we will have different tools, but we also want to consider the possibility of bucketing our tools because of the different type of populations we do have. And yes, we will be sharing the tools for providers to be able to provide comment on the tools.
Thanks. In launching the monitoring of programs in 2023, will that be January 2023 or July 2023? This is one of those where you get to go, yep, it's kind of all of it, right? So different programs, different times. Chastity, I don't know if you have a sense preliminarily, and I'm using the word preliminarily because of course things could change, but do you want to just share what we're aiming for?
Yeah, so we're aiming for starting our monitoring with DV direct services in February of 2023. I'm sorry. We're looking to start monitoring of the FPS programs in February of 2023 and DV direct services in March of 2023. And then we're also hoping that we will start monitoring of CMO, Arts, and Psych in August of 2023.
And that's all preliminary,
Yep.
and things may end up needing to be adjusted, but that's what we're aiming for so far. If an agency already has quality measurement tools in place that ensure we meet the quality standards, would we need to abandon those to move to new measurement tools mandated by DCF? So there, I think, having been a provider myself, I would say that as a provider, if you already have CQI systems in place internally, that's really up to you what it is that you set those up to measure. But DCF's monitoring protocols will incorporate an examination of what's the model that it is that you're delivering, what are your programmatic expectations that are laid out in the contract, and these quality standards as what we are measuring when we're undertaking our monitoring. So it could, if you're self-monitoring, of course, the way that you do that is up to you, but our monitoring will include those sort of tenets as what it is that we're measuring. And to include in the question regarding rollout, when will we know when this impacts our program for rollout? So the Wave 1 programs that Chastity mentioned already know, I hope. And we have not yet landed on what the next set of programs will be as a department. Do you want to just talk about Chastity generally, what the communication plan was, like how we notified people as to their program so folks can know what to expect if their program is next?
Sure. So what we did was we actually sent out letters to all of the providers, to the CEOs, to the presidents, letting them know that we have selected these service lines for monitoring during Wave 1. And we also held a webinar for all of those 5 service lines that we identified to be in our monitoring efforts. And we will continue to do the same once we identify the next set of service lines and so on and so forth.
Thanks. Can we get a copy of the slides? I think we can probably post these online at the Office of Monitoring site. That seems like it's probably the easiest, and then nobody has to look in their email, they'll just be there. My understanding is that you will be seeking input from the various service lines as you work through ways to measure and operationalize the standards. Can you please share the specific ways that you will gather that input and how we can all be involved to share our input? I'm going to ask Chastity to describe just the basic process that her office is using when we're launching a monitoring effort. But I do first want to clarify again, what is being monitored is not just adherence to the quality standards. That's part of what is generally included in a contract in terms of programmatic expectations, but there's often more than just these pieces of information described in a contract. And so as part of monitoring, any of those programmatic expectations really are in scope for the department to monitor. So that's a scope clarification, but Chastity, do you want to talk about the process? And then I would also invite Paloma, Sandy, Molly, if you have anything to add about process, please go ahead.
Okay. So what we have been doing and will continue to do is we meet with the divisions and we seek input from the divisions in regards to what service providers and whom specifically from a service provider should join our working groups. And once we have identified a few folks, we have scheduled working group sessions where we will have discussions in regards to tool development. We receive input in regards to suggested questions, suggested terminology, so on and so forth. And then that information will be incorporated into the tools as soon as it's in accordance and appropriate. We will also be sharing the tools for all providers to provide their feedback. Usually that'll be done via SurveyMonkey. And we will give a time frame for providers to actually look at the questions, provide their responses. We will then export that information and make decisions in regards to the incorporation based on what providers have suggested.
Thanks, Chastity. Molly, Sandy, Paloma, Olana, is there anything you want to add to that? Okay, you don't have to. I'm just making a space if you do. Okay, thanks. Does DCF plan to use any results of these monitoring efforts as a means of determining whether to increase or decrease or cut contracts or budgets for existing programs? I think the way that we've talked about this thus far is that certainly in the first sort of go round of monitoring, it's all new. I don't think we could say out of the gate that this whole new process can result in that type of a consequence when it's brand new to everybody. We're working really hard, I hope it's clear, to make sure the process is very well thought out and that we've thought ahead of any, consequence or thing we need to consider. But whenever anybody engages in something this complex, there's just something we're all going to miss. And then we'll digest that together and see what that tells us. Over time, anything is possible. It gives us information about how networks are functioning, but certainly in the beginning, that's not the intended consequence of these right away. I'll invite the commissioner if you want to add anything there.
Yeah, thanks, Katie. I mean, I think you answered it the way we've been discussing it. I think it's not out of the realm of possibility to think that once this is fully integrated and we're working it this way in the next 4 or 5 years down the road, to be able to look at tying our budget priorities to this. And right now we have a very good budget in this department and in the state. But I think in future years, there's no way that we can determine what that will look like. And so this is absolutely about ensuring that we have a strong service network of quality programs. And so we really are looking to make sure that we're spending the taxpayer dollars in a way that is providing the best services to children and families in the state. And so, as you said, Katie, it's not really out of the realm of possibility to think that maybe down the road, we wouldn't look to tie this to our budget priorities, but that's not anywhere in our thinking in this near term.
Thank you. Will cyber be providing data based on the standards that DCF will be monitoring? I don't know, Molly, do you want to address that?
Yeah, so I think that this will vary somewhat. We've already discovered, I think, that for some of our services, with some very minor limited exceptions for certain records that are being reviewed, most of the record review will happen with what the material that's in cyber. But for different services, that might also entail a site visit or request for records. And I think that that will vary somewhat, but I do think that the goal is to be able to, for CSOC, the goal is certainly to be able to rely on cyber to the greatest extent possible to minimize, well, it's more efficient. It also will minimize the disruption to programs to have us come out on site. So for some, it might be a hybrid, but, and if there's a provider that's, when we talk about CSOC, not all of our programs report into cyber. So that will look a little bit different. Rely on it as much as we can.
Thanks, Molly. The next one is, thank you for the emphasis on inclusivity and cultural responsiveness. Acknowledging there are some system limitations with the current version of cyber, we continue to request updates to cyber and some CSOC communications to further support these efforts, since changes to cyber and DCF communications are beyond the control of our programs. For example, need for more inclusive language and give those we serve expanded identity options. Will the Office of Monitoring be providing internal recommendations as well, or is it intended only to monitor the contracted service lines? I think a way to talk about that is it's intended to primarily be monitoring the contracted provider network, but there's no way to do that in a way that cuts off the possibility of receiving feedback about the department or systematic issues. And I think we're walking in expecting that we'll learn a lot about systemic issues as well, and that feedback will have to go internally. So how exactly will that happen? I don't think we've built that yet, but that would be the expectation. I'll ask Chastity if you have more you want to add in that space.
Okay.
That's fine.
What sorts of records will be audited for DOW programs? I don't know, Paloma or Ulana or Chastity, if you want to speak to that.
So I can start off, and if Ulana and Paloma, I also welcome your thoughts. I think that there's this question, we'll have time and space in the future, very near future, to be able to discuss the sort of records that will be audited for DOW programs, especially because the issue of confidentiality and ensuring also that we protect personal identification. So this will be better answered during those working group sessions as we kind of like think together and brainstorm how we're going to identify records and what records we're going to review and how we're going to protect identity by redacting some of that information. Ulana or Paloma?
Well, I mean, Chastity, you said it, we're still in the process of trying to figure out exactly how to do that, to follow federal and state laws, as well as which protect the survivor confidentiality and making sure that what needs to be done from the monitoring space is able to get done. So as I said, we're still working it out, and that is part of where the partnership with our providers and within JCDV is coming in to be critical. So between DOW, the partnership with the providers, and monitoring, we're going to figure it out, but that is part of what we're trying to work out.
Thanks so much. Okay. That was the last question that appeared in the Q&A. I think if anyone has another question, go ahead and type it in there. But in the meantime, I just want to call your attention to some resources that Jason from our communications team has posted to the chat. So you have there let's see, we've got the link to the part of the Office of Monitoring website. That's the general overview. I think there's also the email address for the Office of Monitoring, and that is where any comments related to the quality standards can be sent. There's also a link to last year's webinar about monitoring specifically on a YouTube link that you can see there. I'll add that the link to the concept paper about monitoring and this concept paper about quality standards, both of those are on the Monitoring Office website as well. And Jason notes that we'll make a recording of this webinar available also. So if there are others on your staff that you want to share this with, you can do that through video or through the concept paper. Another question: at the meeting on March 18th, it was discussed that client interviews as well as record reviews. How many client and record interviews will occur? Will these reviews and selections be random? So the specific details about the numbers of interviews or record reviews and all of that is going to get worked out in your specific working sessions based on the program type. Some services touch a lot of clients and some very few. And so the sampling strategy for any of that will be really different program to program. Will the slides accompany the recording? Not on YouTube, I don't think, but I think we can put them on our website next to where the concept paper will be. I said that because that's my understanding of YouTube, but I learn everything about technology from my 9-year-old son, so I may have underestimated YouTube's capacity.
That's accurate.
Okay. Any other questions? Is there anything that anyone else from DCF would like to say in closing?
Okay, so this webinar has come to an end. We appreciate the time you have given us today. Have a good one.
Bye, everybody. Thanks.
Bye.